Namaste Betiya, Hamisha Khush Raho Betiya. A very good morning to you all. Myself, JVN Dr. Abhi Jain, Assistant Professor, Department of Practice of Medicine, and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In today's session, we are going to start with a new chapter, that is neurology. There are various patients in our OPD that are suffering from different type of neurological diseases. So let us start with the new chapter, neurology, today. Today we are going to discuss about the introduction to neurology and then later on with the other topics. The other topics that will be discussed in this chapter will include headache, different type of headaches. We will also be discussing about epilepsy, seizures, Bell's palsy, etc. So let's start with this particular chapter. Now, before starting this chapter, I must request you all to go through your anatomy book and go through the anatomy of the brain and the spinal cord, because in the neurological diseases, the diseases will be related to your brain and the spine. So in the brain, let's have a quick review. The skull, the first outermost skull, it is having cranium and the inner cortex. In the brain, we have different lobes, which includes the frontal lobe, parietal lobe, temporal lobe, and occipital lobe. So there are different lobes, and it includes a basal ganglia. Then we have a brainstem, we have cerebellum, and the spinal cord. About all these structures you already know, all right, from the knowledge of the first year. If you don't remember all those things, then it's my request to go through all these topics once again and try to remember these points. So let us start with the neurological diseases. What are neurological diseases? Neurological disorders are the diseases of the brain, spine, and the nerves that connect them. So we have different type of neurological diseases. So in the neurological disorders, we have the disease of the brain, spine, and the nerves that connects them. These are the diseases of the central and peripheral nervous system. So we have different type of neurological disorders in which there are the diseases of the brain, spine, and the nerves. So we have the diseases of the brain, we have the diseases of spine and the nerves that connects them. These are the diseases of the central and peripheral nervous system. So we have the diseases of the central nervous system, we have the diseases of the peripheral nervous system. There is structural, biochemical, and electrical abnormalities in the brain, spinal cord, and other nerves that can result in the range of symptoms. So, as I've told you, you have to go through the anatomy book and you have to look for the structures of the brain. Also, from the physiology book, you have to note down the functions of different part of the brain. So functioning is also mentioned in your anatomy book. So these two things you have to see for the reference in order to understand the different type of neurological diseases. So in neurological diseases, there are diseases of the brain, spine, and the nerves that connect them. And these are the diseases of the central and the peripheral nervous system. There is structural and biochemical or electrical abnormalities in the brain and spinal cord or the other nerves that results in the range of symptoms. Now, there are more than 600 varieties of the nervous system that diseases of the nervous system that we come through. Out of these 600, some are relatively common, but many of the diseases are rare. So knowledge of the relevant anatomy and physiology of the nervous system helps in determining the sites of lesion. So there are more than 600 different type of nervous system diseases and that are relatively known. Some of these diseases are common, but many of them are rare. And by knowledge of that anatomy and physiology of the nervous system, these will help you to identify the different type of diseases of the nervous system and how to treat them. Also, different part of the brain have different functions. So if we know the normal anatomy, normal physiology, the normal functioning of the brain, then it becomes very easy for us to understand that if a particular derangement of the symptom is there, then which part of the brain can be affected, and ultimately we can treat that particular part. Now, what are the different causes of different neurological diseases? So for the neurological diseases, we have different causes that includes different type of genetic disorders. So we have different type of genetic disorders that are that we can see. or are responsible for development of different neurological diseases. We have different type of congenital abnormalities. So causes includes genetic disorders, different type of genetic disorders. We have congenital abnormalities, different type of congenital abnormalities. There are different type of infections that can be responsible for development of neurological diseases. So we have genetic disorders, we have congenital abnormalities, we have infections, we have different type of lifestyle and environmental causes that includes malnutrition. Injury is the major cause for development of neurological diseases that includes injury to the brain, injury to the spinal cord and the nerve. There can be different type of metal poisoning, all right, and there can be idiopathic causes. So in the causes, we have different type of causes, which includes the genetic disorders. We have congenital abnormalities. There are different type of infections. We have lifestyle or environmental malnutrition. There is different type of injury. We have brain injury, spinal cord injury, nerve injury. There is different type of metal poisoning that can lead to the development of different type of neurological diseases. And if the cause cannot be found out, then it is known as the idiopathic cause. So in the causes for different type of neurological diseases, we have genetic disorders, different type of genetic disorders. We have congenital abnormalities. There are different type of infections. We have lifestyle and environmental malnutrition. We have injuries, different type of injuries, which includes brain, spinal cord, nerve, etc. There is different type of metal poisoning and idiopathic cause in which the cause cannot be found out. Now we have what are the different type of symptoms that we are going to see. Whenever a patient of neurological disease is coming to us, then what are the various symptoms that we can observe? The symptoms will include paralysis of one part or different part of the muscles. There will be muscle weakness. So we will have paralysis. There will be muscle weakness or the weakness of different part of the muscles of the body. There can be poor coordination of different part of the body, which includes difficult neuromuscular coordination. There can be loss of sensation, which includes different type of paresthesias. There can be seizures, and there can also be confusions, pain with altered level of consciousness. So in these symptoms, there will be paralysis. We will have different type of paralysis. There will be muscle weaknesses. There will be poor coordination. There will be loss of sensations. We can have seizures, confusion, pain, and altered level of consciousness. So the symptoms, the most common symptoms will include paralysis. It will include muscle weakness. It will include poor coordination. There will be loss of sensations with seizures. There will be confusion, pain, and altered level of consciousness. Now, how to manage such cases? Whenever a case of neurological disease is coming to us, then how can we prevent or how can we treat such cases? So the intervention consists of preventive measures. So there are different type of preventive measures that we are going to discuss that could be done in order to prevent various type of neurological diseases from happening. So in the preventive measures, we can identify about the different neurological diseases during the gestation phase. It can be identified in the early phase, and if it is identified in the later stage, then how to manage such cases. So there will be preventative measures. We can also do different type of lifestyle changes that will be responsible for treatment or the management of such neurological diseases. We can also perform physiotherapy and other type of therapies in such patients. There can be neuro rehabilitation, that is different type of rehabilitative measures that could be done. Pain management can be done, how to manage different type of pain. Medication can be given to the patient, different type of medications can be given. And different type of operations. If the case cannot be treated by means of any medicine and if it requires surgery, then medications and operations can be done. Specific diet. This is useful in certain disease conditions where the diseases are due to the nutritional deficiency. So specific type of diet can be given. So intervention includes the preventative measures. It includes the lifestyle changes. There can be physiotherapy or other therapies. There are neuro rehabilitation. There is also pain management, medication, operations, and specific diet. Next, we come to the review of literature. In the review of literature, there was a history of neurology in Guatemala that began with Miguel Molina. who did his post-graduation studies in Celeptire with Pierre Marie and returned in 1922 as a chairman of neuroanatomy and neurophysiology. In 1953, Ricardo Ponce Ramirez took over the chair of neurology at the University of San Carlos. 6 years later, Roberto Renondon, trained in Michigan, founded the Instituto Neurologico de Guatemala. Roberto Ibarra followed in 1962 and Luis Salguero in 1969. Now let us discuss about a case of the neurology. A patient, a 13-year-old boy with a history of occipital headache, who, while practicing relaxation techniques for his pain, developed an episode of general weakness. So there was development of the general weakness. At this onset, he reported a generalized painful sensation, and within a few seconds, it became weak and unable to move his arms and legs. The entire episode lasted a few minutes, and he experiences no loss of consciousness and was speaking coherently. During the event, he felt anxious and his breathing appeared to be labored with shortness of breath. Although he was not hyperventilating, his heart felt like he was racing, but the family noted no change in the skin color. The patient felt no dizziness, there was tingling, nausea, or vomiting. He had no incontinence. After a few minutes, the tachycardia resolved and the patient began to move his limbs. So it's your homework to complete this case. You have to check what are the possibilities that are, or the probable cause that is responsible for this particular disease condition. So this was all about today's introduction to neurology. Let's have a quick review of this particular lecture. So neurological diseases are the diseases of the brain, spine, and the nerves that connects them. These are the diseases of the central and the peripheral nervous system. The structural, biochemical, or electrical abnormalities in the brain, spinal cord, or the other nerves can result in the range of symptoms. There are more than 600 diseases of the nervous system. Some are relatively common, but many are rare. The knowledge of these relevant anatomy and physiology of the nervous system help us to determine the site of lesion. There are different causes. The causes includes the genetic disorders. There are various types of congenital abnormalities, different type of infections, lifestyle and environmental factors. We have malnutrition, different type of injuries to brain, spinal cord, nerve. There is also metal poisoning and idiopathic, different type of idiopathic causes that are responsible for development of neurological diseases. The symptoms includes paralysis. There is also muscle weakness with poor concentration. So we have paralysis, muscle weakness, poor concentration, loss of sensation. We have seizures, confusion, pain, and altered level of consciousness. So the symptoms includes paralysis, muscle weakness. There is poor coordination, loss of sensation, seizures, confusion, pain, and altered level of consciousness. In the intervention, we can do various types of preventative measures. There can be lifestyle changes, physiotherapy can be given, or the other therapy. Neuro-rehabilitation can be done, and pain management with different type of medications. In case when this surgery is required, we can go for operations, and at the end, specific diet can be given to the patient. So this was all about the introduction to neurology. In the next lecture, we are going to start with the different type of headache, the headache classification and different type of headaches. So this was all for today. This session is powered by Digital Version 2.0 Jyoti VIDYAPEETH Women's University. I hope the session is clear to you. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. I have also uploaded the session on the portal, so you can go through that particular session and you can check out for it. So this was all for today. Thank you very much. Have a good day.